All right, today I want to talk to you about Sublocade. Sublocade is a once a month depot injection done subcutaneously, generally around the umbilicus, of buprenorphine, which is the active ingredient in all medicated assisted replacement therapies. So Suboxone, Subutex, Zubsolv, Sublocade, all buprenorphine. This is what it comes as. There's a little pre-filled syringe in there. There is a 19 gauge needle that comes with it. This is what Sublocade is. I will tell you it's a very useful medicine. The injection is done once a month. It lasts more than once a month, more than a month at a time. It takes 6 injections or 6 months to hit steady state. So it's a very stabilizing medicine. When someone is at steady state and they stop Sublocade, they will remain therapeutic anywhere from 2 to 5 months, and it will take at least a year before it's not detectable in the serum. There's 2 doses. This is the 300 milligram dose. This is the first dose that you get. Usually the first 2 doses are 300, and then you can either stay at 300 if your physician thinks you need to, or you can drop down to the maintenance dose of 100 milligrams a month. This is why I want to talk about Sublocade today. Just 2 days ago, my Sublocade rep came in and he had his new area manager. And so I told them this, and I wanted to now put it out there, because I assume they're going to pass this along up the chain and they're going to act like they're like brilliant people. And I'm not saying they're not brilliant, but I 100% expect them to steal my idea. This is what I told them. And I've actually shared this with a local elected official as well, who I happen to know. As we struggle through our opioid epidemic, whenever we have someone, because the great problem is, what do we do to help these people? How do we get them into treatment? How do we keep them, on a path that helps them to get out of their current life situation? I would propose even that when someone is revived with Narcan, that if that's the case, then clearly we're dealing with an opioid overdose. They should be taken to the local hospital and immediately given a Sublocade injection, 300 milligrams subcutaneously. There's a couple things this will do. First off, they're not very happy when they get their Narcan. They just had their life saved. That's not really their big concern. Now they're worried about being in withdrawal. They're not happy. They complain about that. And the other thing is with Narcan, it doesn't last a terribly long time. So it needs to be redosed. Well, instead of redosing the Narcan, I think we should give them Sublocade. Buprenorphine will compete for that receptor. It's a partial agonist at the mu receptor instead of an antagonist. It will likely save them from their withdrawal symptoms, and it's long lasting, so it will be there for at least another month. If we can track those people, over the next month and get them their next shot and their next shot a month after that, we could actually start seeing these people have, improvement in their mental clarity and their ability to understand that they don't have to be in their cycle of addiction. And we may actually start seeing some improvement in our outcomes instead of just waiting for people who are well fed and, taken care of in every other way, but still just end up overdosing on their drug of choice. So Sublocade is useful in the treatment setting. It's very useful. I have many patients on it and they generally do very well on it, but I think it should be used also in the acute setting of someone who has just come from an overdose event to try to prevent them from going down that same path and potentially just being a statistic for one of the many deaths that we are currently dealing in our opioid crisis.